Hi.
Hi, how may I help you today?
Hi, I need to pick up a refill on an albuterol inhaler for my daughter, Faith Harris.
Faith Harris? Okay, let me take a look really quick. Okay, so according to the prescription, you already received one inhaler and you have one refill that's available, but apparently it's a little bit too early. You're in 2 weeks where you can only get the refill after 4 weeks.
Are you sure? You need to recheck your computer there because she needs one for home and one for school, so she needs 2 inhalers.
Okay, well, your primary care physician, your doctor, did not authorize any refills until after 4 weeks of the first inhaler.
No, that doesn't make any sense. She needs her 2 inhalers, one for school, one for home. She needs it. It's in the prescription. Can you just figure it out because I'm in her ear?
Okay, yes, I'll try to go as quick as I can, but I'm going to go ahead and contact your doctor, or your daughter's
That's
doctor,
fine. That's fine.
to clarify the order.
Okay.
Okay, so if you'd like to have a seat in the waiting area, I'll be with you shortly.
No, I'm in a hurry. I'll wait right here. Thanks.
Okay, let me give your doctor a call then.
Afternoon.
Hi, this is Jennifer, the pharmacist. I have a patient here who wants to pick up a refill on her daughter's albuterol inhaler. Her name is Faith Harris.
Yeah, I'm taking care of Faith Harris. Yeah, that's right. I ordered 1 inhaler with 1 refill. And I told her that she needed to wait a month and pick it up and take that one to school. So, what's the problem?
The problem is that she's coming in too early for her refill. It's been 2 weeks and we need to wait for the 4 weeks. So what would you like to do about this?
Cliff.
What?
Cliff, Mrs. Smith is in room 2 getting inpatient. Wants to know when you will be back.
Just tell her I'll be there in a moment. I'm on the phone. Okay, yeah, go ahead and give her 2 and tell her to come in to see me.
Okay, so would you like to give her a refill then?
Yeah, give her the refills.
All right, got it. Thank you very much.
Bye.
Ms. Ferris?
Mm-hmm.
Hi, I just talked to your doctor and it seems like she is willing to go ahead and give you authorization to get your refill. So
Finally, like I said.
I'll have that ready for you as soon as possible.
Okay, thanks.
All right.
So the other day I had a pediatric patient come into my ER with an acute asthma exacerbation. After stabilizing, I was able to speak more thoroughly with the patient's mother regarding her prescriptions, and I learned that the patient had been receiving 2 albuterol inhalers per month. I had a few minutes later to communicate with the patient's pediatric NP and was able to find a few more things out. For instance, the script was originally filled for once monthly with 1 refill, but she changed it and communicated that to the pharmacist, who agreed to the change. So I wanted to have this meeting to discuss what went wrong and how the process can be changed in the future to prevent something like this from happening again.
It definitely sounds like there's a breakdown in communication, so I'd be interested in knowing what exactly happened.
Absolutely.
And yes, why was the script filled for 2 inhalers monthly?
Well, in speaking with the nurse practitioner over the phone, she said that the prescription was originally for 1 inhaler monthly with 1 refill. But the mother went to the pharmacy and complained that the child needed 2, 1 for home and 1 for school. So the pharmacist called the nurse practitioner to clarify, and she agreed over the phone to 2 refills. It sounds more like she was in a rush and she pressed for time when agreeing to the 2 refills.
It happens in practice quite often, and providers get pressed for time, sometimes make decisions on prescriptions based on pressure from patients, wanting to avoid conflict, of course. A good example is the patient or family member who asks for an antibiotic when they've got the common cold.
Absolutely.
Right, and the same time constraints occur in the pharmacy, especially when the pharmacist is busy. So in this situation, the pharmacist was probably a little bit aggravated in dealing with the mother who was already short on time. So the pharmacist probably felt some pressure and thought it was easier to just give the 2 inhalers rather than educate the mother on why that's a bad idea.
Absolutely, I agree. So what are some ways that we can, go about preventing this so this doesn't happen again in the future?
Well, it seems like the most efficient way to prevent this is from occurring again is from the very beginning and providing education to the patient. For a start, there should be better communication between the nurse practitioner and the mother and the patient. They need to explain not only the purpose of the medication, but proper use, but also the amount to be given monthly and why they do that. regular follow-up for the asthma severity. Asthma severity is crucial, and needs to be clearly communicated.
Absolutely.
And along with the follow-up visits, we can do periodic assessments of the patient's asthma control and their inhaler technique. So this can be done through follow-up visits with the doctor, or it can also be done when the patient comes in to pick up their inhaler. So just taking a few minutes can definitely help with that. And we don't know exactly what happened between the pharmacist, the doctor, and the patient at the pharmacy, but we do know that if we can improve that communication, then we'll probably have better outcomes, especially with the patient.
Absolutely. So it sounds like we have some great ideas here for a solution as far as this goes. One way is for the pharmacist to formally tell the patient that they're getting no more refills until the patient follows up with the provider. Another, as you mentioned, is the pharmacist could, pending time, review asthma action plan with the patient, also review some proper techniques on use. I think that by doing this, this could highlight some problems that the patient is having in terms of using the inhaler and how often they're using the inhaler. And these things could be communicated back to the patient's provider. So I think those are some great ideas. Thank you for coming together today.
Pleasure.